Hello, my name is Melissa Jarrett. I am an Indiana State University nursing student, and I have prepared an educational presentation on COVID-19 and community prevention in jails. Before we proceed with the presentation, please take a few minutes and use the link found below to test your knowledge in regards to COVID-19 and jail prevention. At the end of this presentation, you will be able to complete the following learning objectives. Define COVID-19, list signs and symptoms and/or complications of infection with COVID, identify barriers to prevention of COVID within jails, list reasons prevention of COVID in jails can benefit community efforts, list screening procedures for prevention upon entry into the jail, identify infection prevention parameters utilized inside the jail, and identify community reporting resources available for patients released from jail. What is COVID-19? Coronaviruses are a large class of viruses that are common in humans and animals. COVID-19 was a new strain of coronavirus identified in Wuhan, China in 2019. COVID-19 is transmitted from person to person by respiratory droplets. When a person sneezes, coughs, or talks, the droplets can be exhaled. They can then be inhaled by a person 3 feet or less away from the infected individual. The signs and symptoms of infection for COVID are fever, chills, cough, shortness of breath or difficulty breathing, fatigue, headache, nasal congestion, muscle or body aches, sore throat, new loss of smell or taste, nausea, vomiting, or diarrhea, according to the CDC. Associated complications with COVID-19 can be mild to moderate pneumonia, respiratory failure, multiple organ dysfunction or failure, and death. Community prevention recommendations by the CDC are as follows. Maintain social distancing of 6 feet. Avoid people who may be sick. Stay at home if you are sick. Use a face covering when unable to social distance or in close quarters with others. Cover your cough or sneeze with a tissue. Avoid touching your eyes, nose, and mouth. Clean and disinfect commonly touched surfaces. Wash hands frequently or use hand sanitizer when hand washing is not available. According to statistics completed by People in Prison in 2019, 1,435,500 people were in federal and state prisons during the 2019 fiscal year. Each one of those arrestees was processed through a county or jail prior to being sentenced. The potential for close contact with infected individuals increases exponentially as the patients are housed in large groups in this environment. They are also processed in an open area with exposure to many people that may be infected, including, but not limited to, employees, arresting officials, and/or visitors. Identified barriers are as follows. The high cost and shortage of personal protective equipment, the high cost of being able to provide every arrestee, inmate, patient with a mask, and the lack of funds to provide for testing place the inmate patients at an even greater risk due to lack of resources for prevention. Not all jails are created equal. Not only can resources be scarce, but some jails are severely limited on space and housing. Many are often found to be over capacity and having to send most inmates to other facilities to be housed. But the lack of availability to quarantine, possible exposure, or isolate the sick place the inmate patients at further risk of exposure. One of the first identified prevention tactics for jails was the need to develop a screening process for illness. The first prevention strategy for any new arrestee is completion of a screening form prior to entry to the facility. Each employee is also required to be screened daily prior to reporting to work. Any person or persons identified with possible exposure and/or illness are placed in quarantine or isolation where applicable. The The screening requirements for each new arrestee are as follows. Each arrestee is asked, have you been in contact with anyone diagnosed with COVID-19 in the past 14 days? Have you felt ill or had any signs and symptoms of COVID-19 in the past 14 days? Or have you traveled to an area of high incidence of COVID-19 cases in the past 14 days? Most jails chose to automatically quarantine any new arrestees for 14 days before allowing them to be housed in general population as a rule. Some jails did not have this option and had to be more creative in the way that they housed their patients. In order to determine the safest housing, the possibility of signs and symptoms manifesting up to 14 days would indicate under which circumstances a patient would be placed in quarantine or in isolation. For quarantine, newly arrested patients were housed in quarantine barracks for at least 14 days prior to any housing at those sites where space was available. The number of arrests would far exceed the capacity of the housing unit in 14 days, which would prompt a PCR test requirement for early release from the quarantined area. For isolation, this type of housing was reserved for those patients with identified symptoms, were often found post-admittance to the facility after exposure in the previous 14 days, and when found, entire housing units were then placed on isolation status for safety. Regardless of housing assignment, it seems that overnight janitorial staff and inmate patient workers had to learn to protect themselves while sanitizing and cleaning every cell for each new patient. Each common area in every single cell required disinfection. Every door needed to be wiped with bleach, PPE was used for all workers, isolation areas required N95 masks, and education for prevention became paramount. Even with disinfection measures, the risk to the patients remained high. Testing each of those patients due to possible exposure became the new topic of conversation. As a community resource, the local health departments were able to distribute and help to test some of the jail populations, but as the affected number rose, the tests, as well as those trained to complete them, were in high demand. It fell to the jail medical team, if one existed, to come up with a plan to test, track, and provide care for these at-risk patients. Each patient identified as positive with a PCR test were treated with supportive treatment for symptoms, tracked, and then reported to the local health department for tracking within the community. As jails have severe limits upon the amount of time a patient will be housed in the facility due to charges, early screening, identification, and reporting to community health department was essential for tracking and follow-up for each patient released. The CDC recognized these at-risk patients and developed several guidelines for practice of prevention within a correctional facility. They also published the resources for correctional and detention facilities to allow each facility the opportunity to access federal and state grants and information to obtain testing, PPE supplies and equipment, and to provide treatment and hopefully vaccines for their patients on site. Local jails were hit with overwhelming numbers of possible COVID exposure rates and very unsure about how they would move forward into the future. With the changes in the past year of operations, a new normal for operation has actually occurred for many of the jails and local entities. The initial screening will still need to be a part in early detection and identification of those that may have been exposed or are ill. Isolation and quarantine housing is still in use, as it has been shown to allow for identification of those patients that may have been asymptomatic upon arrival. PCR testing that has been so expensive are now being used for confirmation tests for diagnosis instead of being used to determine safe housing. Rapid COVID testing has replaced the PCR for housing regulations. Some jails actually test the patients upon arrival to the jail instead of waiting the 14 days. When patients are able to receive receive supported treatment at the jail if diagnosed. They can, in many areas, even start the vaccine regimen. Each one of these patients is then tracked upon release to the community through the local health department. CDC developed several different handouts for each patient that may be released, and these are often seen being given as information pamphlets to those that are being released back into the community. Please take a few minutes to complete the post-test upon completion of this presentation. Thank you so much for your time and attention.